Hello, my name is Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Candace Collins. She is the Director of Primary and Urgent Care at Northwestern Medical Center. And we're talking about the exciting move of Northwestern Primary Care and our urgent care into the new medical office building this summer. So Candace, thank you for joining me today.
You're welcome.
It's an exciting time.
It's very exciting to be in primary care at Northwestern Medical Center.
And you're doing a great job.
Thank you.
Of managing it all. So before we jump into primary care, urgent care move, let's talk a little bit about you and maybe introduce yourself to our community and what you do for Northwestern Medical Center.
My name is Candace Collins, and I'm the Director of Primary and Urgent Care at Northwestern Medical Center. And I've been working in primary care for 24 years. I got my start running my husband's practice up in Enosburg Falls. And then about 6 years ago, I took on the role as the Blueprint Project Manager for the health service, our St. Albans Health Service area. And the Blueprint for Health is Vermont's healthcare reform initiative. And then 2 years ago, I moved into this role as the Director of Primary Care and recently became the Director of Urgent Care.
Wow, that's a lot. So, and thank you for joining us at Northwestern Medical Center too, because it's been a wonderful addition because of all of your experience and our growth with primary care. So it's been extremely helpful to us. So talk a little bit about where is Northwestern Primary Care and urgent care located now?
Right now, those two practices are located at the back of the campus in the Cobblestone building. And we're very excited to be moving to the front of the campus in the new medical office building in about mid-August. We see that as NMC presenting primary care and urgent care along with the other practices, orthopedics and the outpatient lab, and bringing them to the front of the campus as part of a statement to say that we're open for business, we're open for access to healthcare through primary care and urgent care, and that we are promoting the health and prevention as well as disease management that urgent care and primary care offer.
Yeah, you're absolutely right. Primary care is the center of the healthcare system, and so it needs to be at the forefront of our campus. So you're absolutely right.
All of primary care has been working on creating a medical home for primatients. A medical home is a place where you call first. You try to access the system through primary care. Primary care providers specialize in all care, prevention, acute conditions, as well as chronic condition management and end-of-life care. And primary care is trying to make sure that we've got same-day access for patients. And then if individuals have specialized problems, primary care can help direct those patients to the appropriate resources so that patients are not wasting their money and not wasting their time and getting the care they need as quickly as possible.
That's the way it should be, right?
Yes.
So with this move, how does that actually improve access and care for our community?
Well, first of all, we're going to have more space. So we have recruited 3 new providers to Northwestern Primary Care. And they start arriving in September and October. So we're expanding primary care, and that should expand access. You should be able to get an appointment the same day when you call to see your provider. And then urgent care, we have new providers joining as well. We have a nurse practitioner joining in the summer, and we're expanding that team as well so that there's no waits, no lines, and urgent care can take care of those same-day needs that aren't quite emergency room level. They're not life and death situations. They're irksome problems and other problems that really should be taken care of same day when your primary care provider is not available.
Okay, I was going to ask you about that. When do you call your primary care provider, and when do you call urgent care? And you've answered that a little bit. I don't know if there's anything more that you want to tell the community of when to make those calls.
I think that all of primary care agrees that they want patients calling them first, just to see, can they offer an appointment? All the primary care providers in our community want that. They want the opportunity to at least see their patients, and most patients want to see their doctor, their nurse practitioner, their physician assistant. But there are some days when there's vacations or there's a day off, and that's when urgent care comes into play. They can take care of minor but urgent needs like coughs, lacerations, sprains, those types of problems that don't rise quite to the level of emergency care. Emergency care is really reserved for those more dangerous, more acute, more concerning problems like chest pain, shortness of breath, uncontrollable bleeding. So we're trying to provide that continuum of care from things that are just managed ongoing or can wait, to things that can't really wait, but we don't need an emergency care room, to those, and NMC has long operated the emergency room, which has been here for us for many years, and they are ready and to take on, the urgent thing, the absolutely urgent things that can't wait.
So you're in the back of the campus in Cobblestone, and you're going to move to the front. It sounds complicated to me. How will you make that move with two, it looks like, pretty busy practices between urgent care and primary care?
Along with our partners from orthopedics and the outpatient lab, we've been working on this planning since February. So we've had many meetings. We're meeting twice a week to plan this move, because we don't want any disruption in services whatsoever for our patients. So we are planning to, in about mid-August, we don't have a definite date yet, because construction has its schedules, but we're looking to about mid-August, and we will spend a couple of weeks before that stocking the rooms, furnishing the rooms. We'll take our teams over to practice the new workflows, the moving through the space. And then on Friday, everyone will pack up their drawers and move them over to the new place. And then on Monday morning, we'll open up in the new space.
No, urgent care is open every day, right here?
Yes.
So that seems to fit for my mind for the primary care, because you're not open on Saturdays and Sundays, but how does urgent care fit that? How will folks know, and how will you keep that going?
Well, with our staffing in urgent care, not everyone works 7 days. So we'll use that, whatever days off they have, to move those individuals, their desks. But mostly we have brand new furniture going into the new space in urgent care. We're not bringing much, luckily. It's just our people and our supplies, and all of that can be done in advance. And the same weekend that we move orthopedics and primary care, we will move urgent care as well. And so it's for the urgent care staff, it'll just be a matter of showing up at the new address the next day.
Wow. It sounds like you've worked through a lot of the logistics to make this happen. So.
Well, we've had a big team, and everyone in the hospital, all the departments that are related, from facilities to our community relations, everyone is meeting, and so we're all planning our parts. So it's been a great team building experience. We're really excited. I think that everyone has really run a great project, and this is going to be fun, and it's going to be, I think, a very good thing for our community.
Yeah, exactly. You mentioned new workflows, right? I'm assuming it's different. So any anticipated changes in the flow for staff or patients?
Yes. Since we're sharing space with orthopedics in the outpatient lab, we're going to be able to hand patients off more easily. So we've tried developing all these warm handoffs, which is being able, if a patient comes into urgent care or primary care and needs to see orthopedics, we will be able to hand off the patient that day at the same time to orthopedics. So we've been really looking at our schedules, the way we schedule, the way we work with one another. We have charge RNs that are now helping us run our teams, and the charge RNs will do an assessment and work with the providers to triage patients and make sure that we're running those warm handoffs. Similarly, we're hoping to be able to hand off to the outpatient lab so that people can get their labs done at the same time, right there in the same space.
Wow, so it's almost like one-stop shopping.
That's what we're trying to build out.
You come in that door and all your services are there.
Well, we shouldn't inconvenience patients by saying, we want you to get these services, but you can't have them now, you need to come back. So, because for a lot of people that means taking time off work, and we recognize that. And so this is another attempt to just try to streamline access to care and make it more convenient and more timely for patients.
Excellent. That's terrific. Okay, so what about parking?
Well,
will I be able to get into that building?
Absolutely. When you drive up to the new medical office building, you'll see a large entrance with an overhang. You'll be able to drop your loved one off, especially if they have difficulty ambulating or getting into the building. People won't get wet anymore. And then parking is right in front of that building, so it'll be very convenient for patients. Not a lot of walking. If you do find that you need to go to another part of the campus, we have a new valet service. It's run by volunteer veterans.
I love that.
I know, we are so lucky to have a core of veterans that have volunteered their time, and they're running these really cool golf carts that seat 6 people. They're very,
I love it.
They're very modern and futuristic looking, but they're also going to be able to take people to where they need to go so that no one gets lost.
That's terrific, yeah. So if you end up in the main entrance, can you get to the medical office building? So is it connected? And so what happens if we show up at what seems like the wrong door? Is it still the right door?
Yes, we have a passageway with large windows all across the front that connects the new medical office building to the hospital entrance, right next to where the hospital entrance, the entrance is.
Okay.
And so it'll be covered. It'll be gorgeous because it has large windows, and so everyone can connect. It's part of it's the extension of the design of the new medical office building with the large windows, lots of light, gentle colors, a calm space, and absolutely people will be able to get from the main hospital to the new medical office building and vice versa. And we'll have volunteers that can help point the way and escort people to where they need to go.
Wonderful. So in reviewing the whole project, between the two of us, we'll be able to put this together of what's actually happened. So we redesigned the front entrance so the lobby is different. We have registration right at the front, right in the front door. I'm assuming that will happen as you come through the medical office as well. You'll be greeted right at the front and need to register if you're not already pre-registered for your appointment, which we are doing a lot more pre-registration as well. So we opened up the new medical clinic space at the front of the hospital, which is right next to your building, and also women's health services and OBGYN. So that's right at the front of the campus. And now, again, what's in the building that you'll be in, and that's going to be on the first floor, correct?
That's right. So when you first walk into the new medical office building, you'll see a bank of registration staff. Our patient access representatives are right there. And they'll be able to register you. It doesn't matter which practice you're going to. And then they'll point you in the right direction to get to your practice, because there's going to be the 3 practices plus the outpatient lab all in that building. So it is a new concept for coming in. It doesn't matter where you're going, you'll go to the same place. It gets rid of all the confusion of where to go. And we have started pre-registering patients. So we call in advance and do that registration over the phone at a convenient time for the patient. And then when they get there, all they have to do is just check in and provide their insurance cards, pay their copay, and then the visit will begin. So we feel that it lessens the burden for both people coming for appointments and for us delivering those appointments.
I just love it. It just seems so simple now. You can come, drop off, easy in, easy access, pre-registration, you're ready to go. We've really are trying to respect the time of the patient, and I think that's terrific. So thank you for thinking about all of those logistics that make it flow for the patient.
Yeah, it's been a great project. It's really been great to work with the other departments, the other leaders of the patient access team to, really improve the flow for everyone.
Terrific. And the final step of our full project is we are renovating what was the existing med-surg to make those all private rooms. And if for the community, we have our new private rooms are already online, and so we're renovating our existing rooms so that we'll have all private inpatient rooms, and that will be concluded at the end of the fall. So that will conclude our project. So, but you're next to come online in around August, you said.
Yes, it'll be here before we know it.
Exactly, exactly. So our time is coming to a close, but I might have missed something in my questions, or is there anything that you want the community to know about this move or this project, or what you're doing in primary and urgent care? Is there anything else that you'd like to end on?
Well, I'd like to really make sure that the community knows that we have 3 doctors coming in the fall to join our team, and we're very lucky to have family physicians joining the team, and we're very excited. As we know the definite dates, we will be letting people know through advertising when they can start to make appointments with these new physicians. But we're expanding the team from 4 providers to 7. So this is a major expansion in primary care. And in urgent care, we've got several providers starting up. And so we're expanding that team as well so that we have 2 providers on. And we'll have that access from 8 a.m. to 8 p.m.
That's terrific. So that's really access 7 days a week when you walk through that door.
Yes.
Yeah, that's terrific. That's what the community needs and deserves.
Absolutely.
So, great. Well, Candace, you've been a wonderful guest. Thank you so much, and good luck with the move.
Oh, you're welcome. Thank you so much.
Yes. I'm Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show. And stay tuned. In August, we're going to be bringing primary and urgent care to the front of the campus. And it sounds like it's going to be so accessible, whether it be through parking or ease of access on your journey inside the building. So thank you so much for supporting Northwestern Medical Center.